Good afternoon all, prynawn da pawb. This event will now begin. Mae'r digwyddiad hwn ar fi'n dechrau.
Croeso, diolch am ddod y prynhawn 'ma. I'm Claire Bevan, registered nurse and the senior responsible owner for the digitisation of nursing documentation project. And with me today is Mr. Jonathan Pinkney, the programme manager for the Single Record Digital Health and Care Wales. We'd like to welcome you to this Welsh Nursing Care Record stakeholder engagement event for our health boards and trusts in NHS Wales. The aim is to share the journey of the development of the digital Welsh Nursing Care Record, adult inpatients, as part of the development towards the single record. We'd like to thank you for taking the time to join us today, and we value your thoughts and feedback to inform the next steps of the Welsh Nursing Care Record journey for our patients, staff, organisations and our key stakeholders. There will be an opportunity for Q&A during the session. Please share your name, and time for questions to the panel at the end of the presentation. We will be designing the April Digital Nursing newsletter based on the frequently asked questions and feedback from this series of engagement events. Today we have our two project sponsors with us in the audience, the Chief Nursing Officer for Wales, Sue Tranker, and Ivan Evans, Director of Technology, Digital and Innovation, Welsh Government. We'll also have Helen Thomas, the Chief Exec for Digital Health and Care Wales, and Mr. Rydian Hill, the Medical Director of Digital Health and Care Wales, joining us to take any questions at the end of the session. We'll now start the presentation with Jonathan, who's been the lead principal project manager for this project from the outset.
Thank you for the introduction, Claire. Just to introduce myself, as Claire said, I'm program manager for Single Record for DHCW, and I was the principal project manager for the Nursing Care project. So I just want to talk to you today about the journey in this first part of the presentation, where we've come from and lead up to where we are now. So into the first slide. So the big question, why nursing documentation? Why did we carry out this project? So historically in the early teens, mid-teens of the 20s, we had a number of audits and Inspectorate Wales reports, which identified poor quality nursing documentation. So the completeness and timeliness of the documentation was poor. We also had a situation where there was a lack of document standardization, and not just between different health boards, but often versions of the paper applications and assessments would vary between wards of the same site, which obviously led to a situation of potential inequality of care. You also had a manual auditing process to kind of assess the quality, which would often take nurses away from patient care, which is never a good thing, because that's the reason they're in their job. The paper records were locked down, and there's a low visibility of the patient record, and some of the information which would be important or could be important was inaccessible by many clinicians. And that paper locked away element also led to lots of duplication of documentation, repetitive questioning, which is frustrating from a nurse's point of view, but also if you think from a patient's perspective, if you're getting asked the same questions and having to repeat yourself, you may feel you're not being listened to, which isn't a great basis really for building trust in our relationship with them as caregivers. So this picture, I think, shows the problem from another perspective. Nurses have been very accommodating over the years, and it's led to a really challenging situation whereby something happens and another assessment or care bundle or paper document got added to the list of things to do, which it got to a point where, as you can see with this filing cabinet which sits on the end of a ward, I did count them all, and there are 130 different drawers. Come back one. Here we go. Which can be really frustrating for nurses just to find the documents, but also I imagine they would be banging their legs against that as they were walking up and down the ward. So what were the aims of the project? Well, first off, we wanted to standardise the nursing documentation to help improve quality, consistency and patient experience across Wales. We wanted to reduce the documentation burden on nurses through integration of the system, and also making sure that we reuse data. Ultimately, giving them a situation where they had more time back for patient care. And I think one of the key elements that we tried to bring in was to allow nurses to continue documenting patient care at the bedside. So we looked to develop a mobile compliance solution. All of these things were to help increase patient safety, make information more available to aid decision making, and then use the data to drive quality and timeliness of completion of records. A really good example here is skin assessment. So if a patient ends up with a pressure ulcer whilst they're in hospital, that's obviously a poor experience for them. It means they need more care, they spend more time in hospital, and then ultimately you could end up with a situation where they may litigate. So that's not ideal. And ultimately improve the use of the data, both for auditing, which I mentioned on paper is manual and time consuming, but also make that data available for clinical purposes to make sure that we're using it for everything that it could be used for, and ultimately just to free up time. So this picture I've put on the slide, this was on one cupboard from one ward where the nurses were using WNCR and they were really happy with it. So I thought it's just another good illustration of just how much paper we are talking about. So the next few slides are very much a run through of where we've come from when we started in April 2017, and take us all the way up to the present day. So I'll touch on a few of the key parts of that journey. So first off, we were very lucky to get approved ETTF funding for 1.19 million over 3 years. And also set a really challenging date of November 19 to get something live. Through that first year, we carried out initial engagements, or certainly Claire and our colleague Fran Beadle did. They reviewed the landscape, talking to lots of nurses, understanding the need for standardisation, including which forms were going to be needed in the early phases. But the other thing they identified was the real need for nursing to become a much more involved participant in the digital community. There was a real gap there. And in fairness, Claire and Fran, our colleagues, they really acted upon this, and they set about creating chief nursing informatics officers in each health board to really drive for this change and make nursing part of the digital community. We appointed the project team and started that journey for the CNIO recruitment. And the project board were also formed, and it's worth mentioning that challenging date of November 19. It was really highlighted at that first meeting that how much of a challenge that was going to be. So moving on into 2018-19, this year was really all about standardization of clinical tools, and we engaged with a number of specialty groups, multi-professional sometimes, to give us recommendations for new evidence-based tools that could be standardized and then digitized and implemented via the new application. The CNIO team was formed. I think this was really the start of a journey for everyone. You often hear the phrase that men are from Mars and women from Venus. Well, I think it was often the same with nurses and informatics in the early stages. A good example of this, we were having a discussion in a meeting early on, and the informatics teams were talking about an MI, which to us is a major incident where all the computers and stuff have gone down. But the nurses were looking at us quite perplexed, really, wondering who had had a heart attack. So obviously in the clinical community, a myocardial infarction is what an MI stands for with those teams. So yeah, that illustrates the kind of gap really with the two groups. And we really have progressed on a real journey to develop together over the next 3-4 years. We also engage with lots of senior groups, chief execs, medical directors, directors of nursing, therapies, digital, also finance for things like funding of devices, which are a key part of the project, and also then workforce to prepare the staff for the big change. You know, we're talking about nursing is the largest workforce in Wales. And we also reviewed our technical options and made a decision to utilise an existing NHS Wales in-house development that Swansea Bay had built themselves. I think that was an excellent decision. It's proved great use of NHS Wales-wide resources, and really provided a platform and foundation for us to attempt to deliver against the challenging timescales that we had. We also then, moving into 2019, commenced development of WNCR against the standards that we defined and the requirements, utilising the system that we had that was there to be amended and taken forward as the national solution. So moving into 2019-20, this focus really in the early stages was all about the initial kind of minimum viable product, and that was the minimal set of functionality that was deemed critical for us to go live with nurses. We did get that live for testing, get it out for testing in the summer of that year, and we did identify, unfortunately, there was a large number of sort of minor bugs and tweaks to the way that the application was going to work. Alone, none of them were very significant, but collectively it meant the application wasn't quite ready. And we were really keen to win over the nursing community and felt that they deserved to have the application kind of when it was really going to provide them with lots of benefit and be really slick. So technical and clinical colleagues came together to kind of make this recommendation to our board, to have an additional round of development and testing, and that wouldn't really put us on the back foot from the off with our early adopter sites. So we carried out that extra round of development and testing and planned for go lives in the Q4 of 1920. We managed to get live across 7 sites, 7 health boards, near enough simultaneously. So between I think it was 2 and 4 weeks each. It was well received. Unfortunately, as we all know, COVID hit, and I'm sure everybody's heard more than enough about that. But obviously, it did affect the situation on hospital wards and the NHS in general, and it became, untenable for us to carry on implementing. And even though some sites were planning to leave on, we had to pull the plug on the pilots because of the need to respond to COVID. So moving on into April 2020, we were allocated further funding from the Digital Priorities Investment Fund, and it was great, given everything that's going on with COVID. It was brilliant to get that clarity from Welsh Government and be able to continue the good work of the project team, and also plan to bring in lots more local support from October 2020 to really be boots on the ground and really help with the implementation. We evaluated the pilots. It was a little bit difficult because of the opportunities to engage with nurses, but we did get some feedback. We identified lots of positivity, but also then some key enhancements and new features that would really help benefit nurses if we could implement them into the product. So we planned that for the first 2 live releases, version 2.0 and version 2.1. National implementation, the release version 2.0 went out for testing in the autumn. Again, unfortunately, COVID did hit, and it did affect availability of key staff, and again made the opportunity to implement on wards very difficult. So we kind of bided our time and replanned for the spring after that wave had ended. In December of 2020, we were honoured to be awarded by the Nursing Times the award for technology and data in nursing, which was a UK-wide set of awards, and it was great kudos really for all our great standards work and the amount of work that had been done to build those clinical standards across Wales. So I'm really happy to say that we did manage to get live in April of 2021 in Hywel Dda, Velindre and Swansea Bay. Also then later in the summer, Powys and Cwmtaff joined. I think by this time nurses were really keen to use the application, and I think after the previous year nobody would have blamed them for not being able to face implementation of a brand new way of working, moving from paper to using iPads, but in a style that I have to say really does epitomise the nursing profession. They rolled up their sleeves and they got stuck in and got on with it. And I have to give them huge credit for their attitude, and also then to the support that was provided from both the local and national teams who are, dogged really in supporting readiness for the go lives and then supporting users following the go lives. We're incredibly humbled in November of last year to be awarded a second accolade, this one from the UK IT Industry Awards, which is very high profile, and it was for the best healthcare sector IT project. And I think it's testament, in a very short period of time, we were able to demonstrate just how much difference WNCR was making to the work of nurses, and also then to patient care. And I think it reflects that the project's been a truly clinically focused endeavour and a really great teamwork by the clinicians and the digital teams. More recently, we've been able to get version 2.1 live across all sites, and also got a further year's funding from DPIF to help us continue the implementation and hopefully get it out pan Wales by the time we get to the end of the next financial year. Happy to say that Betsy actually went live this week, and Cardiff and Vale and Iron Bevan are planned for the first half of the year. So what does it mean? What does it mean? Bring us right up to date now. Where are we? We're now live, as you can see by this map. We've just gone live in Betsy, so we're now live across 6 of the 8 organisations. We're live in 20 hospitals with, I think it's actually over 70 inpatient wards, and that is going to continue to grow as our implementation across all of those areas increases. What does it mean? Well, we've now been, say, live for 11 months. Some of the numbers are really big, and it's been great to see, to be honest. We have over 3,000 users every month, and that is continuing to grow. We have had over 4,000 distinct users log in since go live, and we've also allocated over 8,000 temporary accounts, which has been a key bespoke development for us. In terms of patients, nearly 18,000 have been digitally assessed using WNCR, which is accounted for nearly 500,000 digital risk assessments and over 800,000 nursing notes, inpatient nursing notes have been created as well. So we really didn't think it was going to be quite that volume, but it shows just how much nurses have taken to this. In terms of risk assessment, some of the numbers are there, but it's worth noting we've also shared 16,000 of our assessments with the National Repository, making them available across Wales, and 12,000 of those have actually been viewed via Welsh Clinical Portal, and of those views, 16% of them have been across health board boundaries. So it just shows the power of digital data and making that available pan Wales. So I hope you have found that first session useful. If you've got any questions, please post them in the chat, and please include your name. And if we can't get back to you in the Q&A session, we will be able to come back to you afterwards. So the next part, myself and Claire are going to go into the benefits, challenges and lessons that we learned in delivering digital nursing. So I'm going to start with the first 2 slides. So we've tried to kind of loosely couple them around 4 key themes. This one is timely and efficient care. We have, it's worth noting, I've got information from a really detailed evaluation that our colleagues in Neath Talbot Hospital carried out over kind of 5 wards and for over 5 months of the initial implementation. They've approximated that they're looking at around about £18,000 annual saving just on paper. Over that 5-month period, they've released 257 hours of time to care, and that's just the active time saved on assessment. Users in Neath Talbot, 86% of them also agreed that it saves between 10 to 15 minutes every shift. One of the things we're also looking at is how it's saving time in other ways. So palliative care nurse in Powys was able to share that it's saving her, it was 2 hours worth of driving back and forth site just to write in entries in paper notes. So that's really efficient from that perspective, but it's also contributing to decarbonisation across Wales. Another great nugget from Neath Port Talbot, they forecast an annual reduction of 352 hours saved just on retrieving assessments and notes to aid patient care. So that's just the walking back and forth, the trolleys and collecting patient notes. So that's a huge saving. And by the time you kind of multiply some of these things out across all of the wards in Wales, you know, we're looking at huge savings. It's also worth noting, Claire will cover this later, but we're seeing improvements in the quality and the compliance. When you consider that that is improving by around about a third, and they're doing it in quicker time as well, those are really powerful stats. Just to note a challenge, funding of mobile devices to support WNCR on the wards is critical. I think we've been really lucky to be supported. The Health Board's been supported through things like DPIF and also before that ETTF, but obviously the ongoing maintenance of those and you know, they're critical for this solution to work properly. So it's about how we can get the best out of them and using multiple applications as well. A lesson, short-term funding does limit recruitment. It's been amazing to be funded to get this project off the ground, but often we've needed to go at risk to get the right people in. So that's something that should be noted in terms of efficiency. And next slide is improving care via technology. So there's lots of benefits and lessons here. We've picked out some of the main ones. So availability of the patient data to support clinical decision making and auditing has been really important, and colleagues in Neath Port Talbot fed back anecdotally that, you know, it's made their auditing job a lot easier. It's a lot more simplified and a lot quicker. Governance of access to the record has been digitised, including most importantly agency nurses. We're now able via WNCR to record the name, PIN number and times that nurse had access to ensure that it's recorded against the audit of WNCR, even where that person doesn't normally have a login for their health board. So the agency staff are non, you know, they might come from across the border in England. Lessons that we've picked up. So WNCR can help to drive live ADTs. So live ADTs are admit, discharge and transfer. So it's the flow of patients around the hospital. WNCR is driven very much by our PAS application, which tells you whether a patient's in an inpatient ward. Historically, this wasn't always done on time and in real time, where patients came in overnight and on the weekend. It's critical that that happens for WNCR to function properly, and it can drive those live ADTs, but you do need process improvements, and you need to make sure that the staff are properly trained. Provision of Wi-Fi, it's a bit of a obvious one, but you know, that is critical to enable benefit realization. I think we had one instance during the pilots that Health Board was using the same Wi-Fi as you know, the same Wi-Fi as the patients were using, and during visiting times it was getting overloaded and preventing the application working properly. Business continuity. So this is what happens to digitally born data. So data that we're recording primarily first and foremost in digital systems. If that system's down, that is really critical for nursing, and proved something quite late on that we picked up and needed to again build another bespoke solution for, and which is in place to support the live application, but it's something that just needs to be considered very early on when you're thinking about digital applications. And the last bit is just a challenge, student and agency access to digital records. Kind of, you know, it's really best resolved, I think, at North Wales level. Already we've got I think one of the All Wales infrastructure groups working with Health Education Improvement Wales to look at that student nurse and the potential for a kind of, you know, a NADEX ID, which is your login for life. So that's something that I think really does need to be considered in an All Wales level. That's it in terms of my part of this slide. So I'm going to hand over now to Claire.
Hey, so what has been the impact of the Welsh Nursing Care Record on person-centred and equitable care? So if we think about some of the benefits, As John said, the development of the nursing clinical informatics roles in Wales, that's the first. We have over 35,000 nurses in Wales, but we didn't have any with digital expertise, bar our one single leader in digital health and care Wales. So the development of the CNIO post and the clinical nurse specialist in clinical informatics has meant collaboration on an all Wales basis, with a focus on ensuring patients are kept at the centre of the development, and also our staff. So the whole system was designed and developed listening to our patient needs around the standardisation of tools, with the user focus around the system development, listening to what nurses needed to deliver in their roles. 73% of the pilot users, and that was the 7 hospitals that we piloted in pre-COVID, agreed that the Welsh Nursing Care Record certainly helps them complete tasks more accurately. The patient information is reused, and certainly talking to ward sisters across Wales, they have more confidence and assurance that the adult inpatient assessment is completed and the appropriate questions are being asked throughout that assessment. Beneath Port Talbot pilot of the 5 wards that John mentioned, there was a 35% improvement in the adult inpatient assessment compliance, taking the compliance rates above 85%. And we saw slight improvements in relation to the time in which it took to complete the adult inpatient assessment. Some of the paper versions had been up to 70 pages. And with the reduction in the standardisation of the nursing information standards, that had improved the timeliness to complete. 64% of the Neath Port Talbot users agreed that the Welsh Nursing Care Record improved communication between healthcare professionals, and certainly having the opportunity to visit the sites and talking to physiotherapists, occupational therapists, pharmacists about how they can access the Welsh Nursing Care Record from a computer on the ward to ensure that they're able to access the information they need to help plan their care from their professional perspective. The benefit that all patients across Wales are being assessed using the same evidence-based set of clinical tools. And certainly the dedicated clinical representation has informed person-centred care, driving the standardisation and improvements across Wales. Certainly, we can see that the training of our staff to ensure the delivery of the Welsh Nursing Care Record has been a huge benefit, and that's with our business change team. Next slide, John. So, how has the Welsh Nursing Care Record informed and improved patient safety and effective care? Certainly, as John said, the number of documents that we were using across Wales, often those were photocopied and poor quality, the legibility with no signature, dates, times, and poor compliance were all risks that we were carrying in our systems and that were identified in those original audits. We certainly have found the challenge in encouraging nurses to report and escalate issues to the National Service Desk. This is a new issue and a new request for nurses to report any issues in relation to the system. The benefits in Neath Port Talbot, we found up to 53% improvement in the risk assessment completion rates, and that certainly has informed in relation to the timeliness in which the different risk assessments need to be completed on patient admission. There's been improved assurance in the audit trail of documentation for all staff, including the temporary access as well. And this is where we have now improved the governance arrangements around our temporary staff and agency staff who are coming to work in our clinical environments, where we now have their PIN numbers and we're able to audit the standard of documentation and the care delivered. 67% of the Neath Port Talbot users agree that the Welsh Nursing Care Record provides better quality patient information that is accessible for the multidisciplinary team. The big success has been the standardised operating procedure for the standardisation of nursing documentation. And this has been led by multi-professional teams across Wales who are the experts in the field. So where that's been falls, nutrition, patient handling, tissue viability, all the way through the governance and approval process, so that we can ultimately get a standardised approval of a document. And that has been with the issue of Welsh Health Circular through the Chief Nursing Officer Office. A huge benefit has been improved legibility of the record. So we've had the full benefits as well in relation to investing in a scholar who is leading on research evaluation on the benefits of the Welsh Nursing Care Record, and working with Bangor University and the Council of Deans, and that's going to be a very important report to bring all of these benefits together. Next slide. Okay, so what is the future of digital nursing, informing quality improvements and learning across Wales? So we certainly have got an awful lot more work to do. We still have 17 documents that are in the process of coming to the finalisation of their standardisation through the support and the development across Wales. The implementation of the Welsh Nursing Care Record in the Romanian health boards, and we're really thrilled to know that Cardiff and Vale University Health Board will be coming on board later this month, early April, and then an RMBEV in early summer. The professional leadership is really important, because this is a whole new focus on developing nurses within the clinical informatics arena. In order to bring the expertise together with the CNIOs, the CNSs in informatics, as well as the Florence Nightingale Digital Scholars in Wales, we have developed the Nursing and Midwifery Digital Clinical Informatics Advisory Group, reporting to the Directors of Nursing and CNO to advise and bring that specialty of clinical and digital clinical informatics expertise together. The project has also helped inform the development of the Masters, the Digital Skills for Health and Care Professionals in Wales, being led by Trinity St David's University with Professor Wendy Deering. The big piece of work that we've got ahead of us now, that we've already started, is how do we plan towards the business as usual transition, the governance, the funding, the operational management, and the guardianship of the Welsh Nursing Care Record. Delivering the technical roadmap, we're making progress with aligning to the open architecture and along the journey to ensure that we have that open architecture in Wales to share the excellent data that is now coming out of the Welsh Nursing Care Record. So most importantly, using the Welsh Nursing Care Record data and information to drive quality assurance improvement and learning, which is now data that is available to the health boards. So the future of digital nursing in the context of the legislation. So we have the Welsh Nursing Care Record data, and this is going to support the health boards and trusts in Wales with their preparation for the Health and Social Care Quality and Engagement Act, which will become live with an expectation of reporting from March 23. And most certainly the duty of candour and the duty of quality, the Welsh Nursing Care Record data can support organisations with assurance and reporting. The alignment of the Welsh Nursing Care Record data and the Nurse Staffing Act to help again to inform and support the planning of workforce for nurse staffing on our wards, and also using the Welsh Nursing Care Record to support the investigation of complaints and incidents and claims, etc. Having observed just last week senior nurses entering into the Welsh Nursing Care Record, taking minutes to actually find the right information they need to be able to respond and investigate incidents. So professionally, what does this mean with the health and care standards? Well, the Welsh Nursing Care Record has been designed with the care domains and aligning with the health and care standards to help organisations measure compliance. The Nursing and Midwifery Digital Clinical Informatics Advisory Group will also be held as a professional advisory group to be the guardian of the Welsh nursing care record, but also to provide that expert advice in Wales. In relation to the future collaboration to the developing digital ward, it's really important to understand that the Welsh nursing care record is just one small part of the jigsaw, and in collaboration with the other projects and programmes, how do we improve and share the learning together to help inform the formation of the digital ward to improve the experience of staff, but most importantly, the experience for patients and their outcomes. So, the future in relation to quality, performance and improvement. The benefits of the Welsh nursing care record at an all Wales level, with standardised information, so wherever patients flow across our services, where staff work across our organisations. At an organisational level, the Welsh nursing care record can help inform workforce planning, efficiency, effectiveness and value, and with the opportunity for monitoring compliance to drive that improvement. At a ward and team level, improving staff experience, performance, improvement, resource management around staffing, equipment, materials and training. And most importantly, at that patient care level, focusing on patient safety, patient experience and patient outcomes. So just like to give a little bit of an example of one of the tools in our standardised nursing documents, the Purpose T, the skin and pressure ulcer risk assessment. We moved from Waterloo to Purpose T, which was a big shift in Wales. However, the application of the risk assessment into the Welsh nursing care record has now generated over 76,000 assessments on about 18,000 patients. So we have rich data and information in the system already. This data can be shared and triangulated and reviewed, used along with the professional judgment of nurses, triangulated against DATIX incidents, complaints, claims, patient flow, and the other data that we have as a plethora of data within our organisations. This then can help us assess our compliance. How can we improve our safety, assurance and quality improvements? To review the processes, review our workforce, our training, equipment. What do we require to improve the outcomes for our patients in relation to pressure ulcers and skin care? This will drive value, efficiency and effectiveness of care as well as patient outcomes. So we need to be able to use the data that's in the Welsh nursing care records to repeat the cycle of quality, monitoring and review. And again, as I said, this will help with our duty of candour and duty of quality within the Quality and Engagement Act. So I hand over to John.
Thanks, Claire. Okay, so I just wanted to touch really, I think, to add a little bit more kind of meat to the bones of some of the things that Claire was talking about there. You know, and I think what we do with this nursing data, it's been brilliant to be able to capture it digitally. The big question is, so what are we going to do with it? And actually, it's how we use that data, you know, in a really constructive way to help nurses, to help people who can, you know, who plan care, you know, and to look back and identify poor performance, good performance, and you know, give us opportunities to identify good practice. So I just thought I'd bring together a few dashboards, and these are mock-ups just to show exactly how this might work. We've just recently made the data available to our colleagues a couple of weeks ago, and we're starting to work on some of the early uses of that data. And you know, it really moving forward, it's how we can use the data to drive performance and quality improvement. So this example dashboard is a patient level. You know, it gives you the ability to see very quickly the status of assessments. So, you know, is the patient up to date with, you know, the AIA, which is the adult inpatient assessment and the bit that gets filled in once a patient comes into hospital, looking at their due dates, risk assessments, are they up to date? Is there anything that is behind where it should be? And the ability also then to link into a potential kind of to-do list. That's a future development, but could link in really strongly with one of the new forms that we've mentioned, which is a care planning module. Moving on from that, you've got then a ward view. And again, this is looking at one specific ward, I think in a health board in Swansea Bay, a ward in Swansea Bay Health Board, sorry. But essentially it's showing something that a ward manager could view to review performance on the ward. So, is a risk assessments up to date? Are any of them overdue? Has the initial assessment and care domains, which is the clinical information about the patient status, are they started or do they need to be completed? And highlight any patients who then need to be looked at, and that can help a ward manager potentially drive the work of the nurses on that ward to make sure that everybody's care is completed at the right time and also documented properly. Also, the ability to filter on the number of patients with skin ulcers and how many types of skin ulcers they have. This one is about patient handling, a panel to show you how many patients perhaps require equipment or how much equipment we need on that ward or is deployed. There are implications then hospital-wide if you take that up a level. We could also then be identifying the number of patients who are infection risks, how many need to be isolated. And also then, as Claire has mentioned, triangulating the data from WNCR with other applications. So I'm thinking of things the nurse staffing systems to identify wards who've got gaps and what the care implication and what the quality of care is on those wards. So there is endless possibilities really. But once we get to be able to provide live data, there's a whole range of things that we can do to work with nurses to develop this type of stuff. And this example dashboard is just a very high level example of a historic dashboard looking back at previous days, weeks, months or quarters. Again, things like risk assessment compliance, how many have been done per patient, how many were done within target timescales. Which care domains have been completed and which aren't. Obviously, the ability to filter by health board, hospital and wards is going to be able to identify good practice and areas for improvement. And again, that triangulation with things like DATEX may be able to help identify areas for improvement and ways of working that can drive that. And then the automation of this, again, I've mentioned earlier in the presentation, nurses are largely manually doing reviewing the quality on paper, and the ability to just press a button and produce this data and give it to the auditors will save huge amounts of time and also open up the ability for almost every single digital patient then their data to be included in the audit. So that's very much just to give you a little bit of a flavour. They're certainly not something that will look like what it looks like when it comes to fruition, but we just wanted to give you a flavour of what's coming and the art of the possible in the future. So I hope you found that helpful. I think we're going to just finish now with a video, which is just going to show the view, I think, of the nurses, some of the nurses who've been users of WNCR and what it has meant to them. Not sure if I found some technical problems. I don't think we're getting sound, Daisy. Apologies, I'll just take a second for us to re-bring that up. Thank you, Daisy. And we've done lots of this engagement out with nurses on the wards, and I think the resounding message that we've had when we've spoken to them is they absolutely love it, this new way of working, and they don't want to go back to paper. In fact, they're really keen for us to get the rest of the documents standardized so that they can do the majority of their work then on digital. Well, thanks, Daisy. I don't know if you want to.
Hi, my name is Christine Evans. I'm the ward manager on the Neuro Rehabilitation Unit in Newport Talbot Hospital. It's become such a fantastic way forward for nursing, in that it's clear, concise documentation. There's no room for error. It highlights all the risk assessments that we need. It's easily accessible for everybody, all the MDT, physios, occupational therapists, speech and language. Anybody can access the WNCR at any time. It's become a real valuable piece of equipment for the nursing staff.
It's changed how I work because everything is in one place. You never lose a bit of paper and you don't have to run around the ward looking for something.
I think it's better to capture all the information with the patients as well, so you can go through everything in one go. So it definitely saves time, and I think it's better for patient care because it means we can spend more time with them than completing paperwork.
It's a lot easier. All the information's at a touch of a button, all the risk assessments are there, and we can read everybody's writing.
The system's been quite easy to use. We were given a lot of support and reassurance from the IT department when we first got up and running, and the access to it is quite easy to navigate once you get used to it.
Using the computer to input patient notes have been very beneficial. On a personal level, I'm dyslexic and I find it very difficult with my spelling, so it takes me a lot longer to write my notes. But using the computer format has eliminated that problem, so it's levelling out the playing field a bit, really, and actually enabling me to speed up my notes because I'm not having to Google how to spell everything. So it's much easier, and it also makes it easier to understand other people's notes because everyone's got different ways with their handwriting, so it just makes everything clearer.
Hi, I'm Trudy Young. I'm the tissue viability nurse here at Velindre. For me, the important thing is about the pressure ulcer risk assessment we use at Velindre, which is a Purpose T tool. The Purpose T tool is part of the risk assessment suite on the WNCR. And what I like about it is that staff, when they're completing it, cannot submit it unless it's completed in full. So where in the past, when we used the paper versions, we had errors and omissions, this doesn't happen with the Purpose T, and that's absolutely superb. Also for me, for audit purposes, I can look back at the scores, look at the equipment being used, and it helps me to give a picture of what's happening to the patients on the ward in relation to their pressure ulcer risk assessments. It's a great benefit to me.
Hi, my name is Jane Brady and I'm the Senior Lead Nursing Informatics Specialist for Betsy Cadwallader University Health Board. For me, we're at a very exciting time in BCU currently because we are planning to go live hopefully the first week of March with the Welsh Nursing Care Record, and that will be in one of our community hospitals. We've started that engagement and had conversations and trying to get plans in place, and the feedback that we're getting currently is that everybody's really excited about it and feel that it's been such a long time coming that they can't wait to get going.
Okay,
Is it
thank
over
you.
to me now?
Yeah, we'd like to hand over to you, Helen. Thank you.
Marvellous, thank you. Amazing, actually. I sat through the all of that. Amazing to see kind of the impact that that's had, the progress that's been made, the collaboration. Actually, that really shines through. Hence the team awards and the best project awards. I think it's just a fantastic example that I use frequently, actually, when I talk about kind of examples of truly kind of clinically led, digital projects and programs. It's fantastic. So we've got a couple of questions. So the first one is from Mary, Mary Jones in BCU. Is there a date when it's coming live to mental health and learning disabilities divisions? Claire, do you want to pick that one up?
Yeah, do you want me to take that one? Yeah. So Mary, thanks for your question. Obviously, the start of the Welsh Nursing Care Record journey was to focus in on adult inpatients in acute areas and community hospitals, and understanding that the delivery of the model, obviously, of the digital clinical record is a multitude of systems all working together in collaboration. So within mental health, we have obviously a particular work stream which is being under the umbrella of the Welsh Community Clinical Information Service. However, it doesn't mean to say the nursing information standards, whether it's critical care, mental health, adult inpatient, the nursing information standards are all worked in collaboration. Within Digital Health and Care Wales, we have clinical nurse informatics for mental health, for critical care, for community, all working together with Fran Beadle to ensure that those information standards are the same. So those digital ways of working will be coming out across the other specialties, but I'm afraid I can't give an exact date and time, sorry.
Thanks, Claire. Another question, an anonymous question. Is there no live dashboard functionality now at all? John, do you want to pick up on that one?
Yeah, I can pick that one up, no problem. So we don't have live dashboards per se in the application. In our most recent release, version 2.1, we did include something called a notifications feature, which really flags up to the nurse that something needs to be done for a particular patient. So when they look at their patient list, they can see a risk assessment of some sort is kind of, it's due to be done soon or it's overdue. And the same then in terms of the adult assessment, something needs to be done. So that's very much a early part of that deliverable to try and help nurses understand the data more. We've just released the data, as I mentioned in the presentation. We're going to be working with our clinical colleagues and information teams to understand how that can contribute towards dashboards, as I've illustrated, to help nurses guide their caregiving and where they need to put their effort. And equally, we're also working then down the line with other programs of work, things like the National Data Resource Program, NDR, to think about how we make real-time data available. And that's not just then dashboard within WNCR, it's how we can link some of the indicators in WNCR up to other clinical systems. So, for example, this patient is at risk of falls, or this patient needs a risk assessment, this patient has a particular condition. How can we get those pieces of data and integrate them live with other applications to really provide even more benefit of the way WNCR is working? So we don't have a live dashboard quite yet, but we're going to be working on that with our clinical colleagues and information teams over the next 6 months, I think.
Great, thank you, John. We've not got any other questions from the audience, but I'll take Chair's, what's the word? Can't remember the word now, it doesn't matter. Prerogative, that's the one. Yes, what's been the golden nugget? If you had to choose one element of this project that's made it so successful, because clearly that that success is jumping off the page, and it in all that you've said today, what's the one thing you think that has made it so successful? Let's start with Claire and ask John as well.
Okay. Well, I think most certainly it's been about early engagement from the outset and ensuring that stakeholder engagement throughout the life of the project. And that is from a multi-professional, multi-stakeholder perspective, not just about nursing. But absolutely, whether that's been our clinical nurses delivering direct care, you know, all the way to chief executives and the executive peer groups across Wales, but most importantly with our, you know, our expert digital advisors and technical colleagues. It's been about everybody working together, but it's been about communication, engagement all the way through the journey of this project.
Thanks, Claire. And John?
Thanks. Yeah, really good question. There's a couple of things for me. I think the first thing really is just that dedicated access to a clinical group who've really been, you know, fully focused on this project. And I think it's absolutely critical for a project team to be able to really ingratiate that team into the way in which we work in digital, with the development team, the business analyst, the project team, the information guys. I think it's really made the project sing, you know, and you know, we've managed to get to a point where we've got a really good relationship between everybody. We have had our bumps in the road, I think, as any good team has. We've had our rough patches and we've not been able to agree on certain things, but you know, I think, you know, it's something that really has been the pillar really that the project's been built on. And I think the other thing that I'd probably mention about that team as well, that, you know, that All Wales nursing team have really been able to, you know, get to a point where they can kind of make concessions and come to an All Wales position, which has been important, and get to the point where as a team they kind of really trust each other to make decisions. So that's been really helpful in getting clarity. And the other bit really is just about the standards. Obviously we've built this from the clinical standards up. You know, I think it's really given us a good ground from the start to build from that direction, and say that clinical focus, it kind of sits there and in the links with the team as well. So
yeah, I'd cite strong teamwork and strong leadership as things that jump out for me as well, actually, in terms of my observation of it. So well done to you both and the team. Bridget, did you want to come in for just have a quick comment or observation before we finish off?
Thank you. Well, first of all, I wanted to thank everyone involved with this presentation and the wider team in terms of what they've done. I think the nursing community have shown unity and leadership that many other professions, including my own, could learn and follow. I'm acutely aware of the fact that we need to retain the nursing workforce that we've got, and we need to recruit, and because of the workforce demands, and this is a key enabler of that, enabling people to do what they're trained to do, which is spend more time caring. So well done, please keep going, and I look forward to seeing this being pervasive on every ward that I visit as a clinician.
Excellent. Yeah, I think that's it then. Claire, last word from you.
Okay, well, I just would like to thank everybody for participating in today's session to help inform this exciting journey as we go into the next chapter of the Welsh Nursing Care Record. I'd like to emphasise this is being recorded, so we will be able to share the recording of today's presentation out there far and wide, because we want to celebrate this together and to keep that collaboration and working together to make this the best for our patients and for our staff. So thank you very much.
Well done, everyone.